I'm Kim Norris. I'm a student from South Alabama College of Nursing, and I'm going to perform a neurological assessment on you today. Is that okay?
It's fine with me.
Okay, perfect. And so I'm going to start, and I'm just going to look at her appearance.
Do I need to stand up?
You can stand, yeah, stand for me. And I'm going to look at her appearance. Okay, she looks well groomed. Her hygiene looks good. She looks, erect. Posture looks erect. And so now for her behavior, she's smiling at me. She's waking alert. Are you having any issues with depression or anxiety? No, and if you were having any issues with those, I would get the appropriate screening tools, okay? And now I'm gonna move on to your cognitive function. So what is your name?
Haley.
Okay, Haley, where are we?
We're in class.
Okay, we're in class. And what time of day is it?
It's in the morning.
Okay, and now I'm going to test your recent memory. I brought your tray into you this morning with food. So what was on your tray that you had for breakfast? What did you have for breakfast this morning?
Oh, I had a protein shake.
Okay, and so I know that because I can verify because I brought a tray in. So yes, you had a protein shake. For your remote memory, who was the president before Donald Trump?
Barack Obama.
Okay, so that's good. And now I'm going to test your judgment. So the first thing I'm going to test your abstract thinking. If I say to you, it's like finding a needle in a haystack, what does that mean?
It's hard to find.
Okay, very good. And now I'm going to test your judgment. If you were driving down the street and you saw blue lights behind you, what would you do?
Pull over.
Okay, and where do you expect to see yourself in the next 2 years?
Hopefully I'm graduated.
And
working somewhere.
as a
Nurse.
perfect, yes, good, okay. And so now I'm going to move on and I'm going to test your cranial nerves, okay? So the first cranial nerve we're going to do is the olfactory nerve. So I need you to occlude one nostril and sniff, okay? Occlude the other nostril and sniff, okay? And now what I need you to do is close your eyes for me, and I'm going to have you occlude one nostril and have you identify the scent, okay? Okay,
Cinnamon.
very good. All right, now I'm going to have you occlude the other nostril.
Gum.
Okay.
Or mint.
Mint, okay, yes. Very good. So your cranial nerve 1, your olfactory nerve is intact. The second cranial nerve is the optic nerve. So to test the optic nerve, you typically could use a Snellen eye chart, and you're going to have the patient stand 20 feet away. If you get a reading of 20/50, what that means is at 20 feet, this person can see what the normal eye sees at 50 feet. I do not have that today, so I'm going to use the handheld vision screener, and I'm going to hold it 14 inches away from your face. I need you to cover one eye and read the lowest line.
3, 7, 4, 2, 5, 6.
Okay.
Oh, it was 8.
Okay, so Miss Norris is blind. She read 20 over
30.
20 over 30. So that means at 20 feet she can see what the normal eye sees at 30 feet. And I would do that bilaterally. So her cranial nerve 2, her optic nerve is intact. Next I'm going to do cranial nerve 3, which is the oculomotor nerve. And so I'm going to do Perlac. And so I'm going to look at your pupils. And her pupils are, this way, it'll help me out here. Your pupils are about a 4. Okay, and so now her pupils are equal and they are round. Okay, and so now what I'm going to do is I'm going to check your direct light reflex. So I need you to just look ahead for me, and I'm going to shine the light in your eye. Okay, and your pupil constricted. Now I'm going to check for consensual reflex. So what I need you to look ahead, and what I'm doing is I'm going to shine the light again in your right eye, and I'm going to look to see if your left eye constricts as well. Okay, and it did. So she has direct and consensual light reflex. The next thing I'm going to do is test accommodation. So I need you to look away at the exit sign up there, okay, and your pupils did dilate, okay, and now I need you to look at my finger, okay, and her pupils constricted. Now that's accommodation, and now I want you to follow my finger in towards your nose, okay? So perfect. Her eyes converged on their axis. So her pupils are equal, round, reactive to light. They accommodated and converged. Okay, so the oculomotor number 3 is intact. But I'm also going to check the oculomotor nerve, which is cranial nerve 3, the trochlear nerve, which is cranial nerve 4, and the abducens nerve, which is cranial nerve 6. And how I'm going to do this is testing your extraocular movements. Okay, so I'm going to make sure that you have good parallel tracking. I need you to just follow this pin light, okay? So okay? She had no nystagmus noted, and she did have good parallel tracking. So cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, cranial nerve 6, the abducens are intact. Okay, so now we're going to move on to cranial nerve 5, which is the trigeminal nerve. So I need you to clench your jaw for me, okay? Can you tender this? Okay, and now I'm going to pull down on your chin, and I want you to resist me from opening it, okay? All right, very good. So the motor portion of trigeminal number 5 is intact. Now I'm going to do the sensory portion. So I need you to close your eyes, and when I touch your face, I want you to tell me now when you feel it, okay?
No. 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 No.
Okay, so that's the sensory portion of the trigeminal nerve. So the trigeminal nerve, cranial nerve 5 is intact. Now I'm going to move on to the facial nerve, which is cranial nerve 7. So I need you to copy some of my facial movements, please. We're going to puff out your cheeks. We're going to raise your eyebrows. We're going to smile, frown. Okay, I want you to close your eyes and resist me opening your eyelids, please. Okay, very good. All right, now we're going to do this. So the motor portion of cranial nerve number 7 is intact. To test the sensory portion, which we're not going to do today, I would place something salty or sweet on the anterior 2/3 of your tongue and have you identify it. So cranial nerve 7, motor and sensory portion are intact. Now we're going to move on to cranial nerve number 8, which is the acoustic nerve. And so what I need you to do for me now is I'm going to stand 2 feet in front of you. I want you to cover one ear. I'm going to say a word, and I'm going to whisper a word, and I want you to identify it, okay? Okay, cover the other ear. Okay, I don't detect any high sensory hearing loss, so cranial nerve 8, the acoustic nerve, is intact. Now we're going to test cranial nerves 9, which is the glossopharyngeal, and cranial nerve 10, which are the vagus nerve, and we're going to test them together. Okay, I'm going to have you open your mouth wide, see out your tongue, and say, ah. Okay, her uvula is midline and rhizome phonation. I would also, I'm not going to do it today, but we would typically take a tongue blade and elicit the gag reflex. And then the other part of that, the sensory portion of cranial nerve 9 and 10 that we do is we place something on the posterior 1/3 of the tongue, salty or sweet, and have the patient identify it. So cranial nerve 9, her glossopharyngeal, cranial nerve 10, her vagus nerve are intact. So now I'm going to move on to cranial nerve 11, which is her spinal accessory nerve. So I'm going to have you resist, okay? So you resist, turning your head, good. Good, and now I'm going to push down and you lift up on your shoulders, very good. So cranial nerve 11, her spinal accessory nerve, is intact. And now I'm going to move on to cranial nerve 12, which is your hypoglossal. So I need you to stick out your tongue, please. Okay, your tongue is midline, it does not deviate to the left or the right. And now I need you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, very good. So cranial nerve 12, her hypoglossal nerve, is intact. Okay, so now what I'm going to do is have you walk for me. If you will walk, face this way, and I want you to walk towards the table. Just walk regularly, please. Okay, turn around. All right, I notice her gait is smooth and rhythmical. Okay, now what I need you to do is heel-toe walk for me, tandem walk for me. Back to me.
I almost fell.
Okay. Very good. I noted minimal swaying with that, okay? The next thing I'm going to do is the Romberg test. So I need her, I'm going to step out a little bit. I want you to put your feet together, put your hands by your side, and I need you to close your eyes for me, please. Okay, I would typically do the Romberg test for 20 seconds, support my patient. Okay, I don't note any swaying. You can open your eyes now. So I would say that is a negative Romberg test. Okay, the next thing I need you to do is come sit here on the table for me. Okay, so this is sharp, this is dull. Okay, so I just need you to identify. I need you to close your eyes for me. Okay, I'm going to push up your sweater sleeve for just a minute.
Both of them or just
Just
that
both of them, if you will, please. Okay, so please identify for me, is this a sharp or dull?
Short. Dull. Dull. Dull.
Okay, sensory portion is intact. She was able to identify sharp and dull. Okay, now we're going to move on to your reflexes, okay? So the first reflex I'm going to do is your bicep tendon. Yeah, you can flip this a little bit. Okay. All right. So can y'all see over there? I'm trying to get where y'all can see. Everybody? I'm trying. All right, I'm just trying this way for me so hopefully I can elicit it. Okay? Did you feel it jump a little bit? Okay. All right. That's all I'm going to do. I'm going to keep on. All right. So now I want you just to relax. Find your tricep tendon. Okay. Just relax. Let me support your arm. Ah. She's not going to give it to me. Like a little bit there. Okay, a little bit. Yeah, I saw a little bit on that one. Okay, now I'm going to check your brachioradialis. But yeah. So just relax and let me hold your arms. Do you feel anything? No? Okay. All right, that's fine. Okay. Check your brachioradialis. Okay, now I'm going to do your patellar. Okay, I need you to put your hands together and pull apart. You concentrate on that. Y'all hear me getting her? A little bit. Got a little bit. There we go. All right. Okay, now I'm going to get you to take this boot off or this shoe off. Gosh, it's okay.
My feet are sweaty.
It's all right. Now I'm going to do your Achilles. She's a tough customer. Okay. All right. Last, I'm going to do your Babinski. Okay. Okay, her reflexes are almost like right, +1. But it also, you know, again, but 2 is a normal finding for reflexes, okay? All right, so throughout this test, I have been using the Glasgow coma scale. So the Glasgow coma scale, the lowest score is a 3, the highest score is a 15. Anything below a 7 is considered a coma. I would give you a score of 15 because you would get 4 points for a spontaneous eye opening. You would get 5 points for verbal response because you answered me, and you would get 6 points for motor response because you did perform the motor portion well. So you get an overall score of 15, and that completes my neurological assessment. Did I pass? Did I make an A? Woo! I made an A.